Good morning. Let me ask you something simple, but important. When you feel that strange ache, when you get out of breath walking up the stairs, do you ever wonder, is this just getting older, or is it something else? We've all been there. The body feels different. We shrug it off, blame age, stress, maybe indigestion. But sometimes, those little whispers, they're your arteries sending a silent warning, a warning that your heart and your life could be at risk. And the worst part? Even when you try to speak up, many of you get dismissed. You go to the doctor, you describe the chest discomfort, the crushing fatigue. What do you hear? It's probably just anxiety. Maybe it's heartburn. Let's wait and see. I've read your stories. Like Sue, she felt ignored. She was told it was acid reflux, when in reality, her arteries were 99% blocked. The fear is real. The frustration is real. And the danger of a silent heart attack or stroke, what doctors sometimes call the widowmaker, is a terrifying reality for too many families. But today, we change that. Today, we learn how to listen to the body's warning signs, clearly, calmly, with confidence. We'll break down the real signs that your arteries may be blocked. Not complicated medical terms, but real-life symptoms you can recognize. The small signs that could help prevent a heart attack or stroke before it's too late. This isn't about fear. It's about control. It's about protecting your heart, your brain, your independence. It's about senior health. It's about making sure your future, your wellness for life, stays in your hands. The first and most famous warning sign, chest pain. But forget the movie scene where someone clutches their chest and collapses. In real life, it's often more subtle and more dangerous. For many, it feels like pressure, a heaviness, like someone is sitting on your chest. But here's the tricky part. Sometimes it feels exactly like indigestion or heartburn. That's why so many heart attacks go unrecognized until it's almost too late. Let me tell you about Chuck. He's a retired teacher, active, seemingly healthy. For 18 months, he felt mild indigestion every time he walked. He thought it was the food, maybe acid reflux. But in reality, his heart was begging for help. When Chuck finally saw his doctor, tests revealed severe artery blockages. He needed immediate bypass surgery to restore blood flow. Chuck was lucky, but many others aren't. Think of your heart like an engine. Your arteries are the fuel lines. When plaque builds up, it's like gunk clogging the fuel pipes. The engine struggles, sends out warning signals. That discomfort in your chest, it's your body's check engine light, a sign of a possible heart attack. Ignoring it, that's what leads to life-threatening emergencies like stroke, heart failure, or worse. Sign number 2, shortness of breath. You walk from your car to the store and suddenly need to stop to catch your breath. You play with your grandchild and feel winded. First thought, must be getting old. When your heart has to push blood through narrowed, blocked arteries, it struggles. It can't deliver enough oxygen to your body. It's like trying to run a marathon breathing through a straw. Your brain reacts fast. Breathe harder. But no matter how much you breathe, without enough blood flow, it's never enough. Feeling short of breath doing simple tasks isn't normal aging. It's often one of the first signs your arteries are clogged, increasing your risk of heart attack or stroke. And let's be honest, breathing freely, it's the foundation of happiness, of senior health, of enjoying the little moments. It allows you to walk, laugh, play with your grandkids without fear. Ignoring shortness of breath, that's ignoring your body's plea for help. Sign number 3, profound fatigue. This isn't normal tiredness. This isn't, I need coffee, tired. This is bone-deep exhaustion. It feels like your battery only charges to 20% no matter how much you rest, and it doesn't go away. This kind of fatigue steals your life. It drains your ability to work, to enjoy your relationships, even your desire for intimacy. You lose the energy to chase your goals, your happiness, your success. Why does this happen? Poor circulation. When your arteries are blocked, your body shifts into survival mode. It prioritizes blood flow to your heart and brain. Your muscles, your energy reserves, they get cut off. You're operating on limited power all day, every day. If you've been feeling exhausted for weeks without a clear reason, this isn't laziness. It's your body sending a warning your heart health may be compromised. Ignoring it? That's how small artery blockages lead to major events: heart attack, stroke, long-term health decline. Sign number 4, pain or cramps in the legs. Peripheral artery disease, PAD. You're walking through the grocery store. Suddenly, your calf cramps up. You stop for a minute, the pain fades. Seems harmless, right? That's what Harold thought too. At first, it felt like a simple leg cramp, but then it happened again and again. It became harder to ignore. This is a critical, often overlooked warning sign. Doctors call it PAD, peripheral artery disease. It means the arteries in your legs are narrowing, restricting blood flow. But here's the bigger issue. Artery blockages tend to be systemic. If your leg arteries are clogged, there's a good chance the arteries feeding your heart and brain are also compromised. Think of leg pain while walking as the canary in the coal mine. It's an early sign your cardiovascular system is struggling. And PAD dramatically increases your future risk of heart attack and stroke. Don't brush off leg cramps. They could be your body's first plea for help. Signs number 5 and 6. Nausea and cold sweats. You feel nauseous. Maybe you think it's your stomach acting up. Then the cold sweat hits. Clammy skin, that unsettling damp feeling. Many brush this off as stress, bad food, or nerves. But here's the truth. Your body has an emergency alarm system. When your heart is under severe strain, struggling due to blocked arteries, it triggers a fight or flight response. That's where nausea and cold sweats come from. Your system is sounding the alarm. If these symptoms show up, especially with chest discomfort, do not wait. It's your body warning you your heart health is in danger. Ignoring it could lead to a heart attack or stroke. Sign number 7. Palpitations. Your heart flutters. It skips a beat. It races unexpectedly. That's called palpitations. Sometimes it's harmless, but sometimes it's a warning sign. One common cause is atrial fibrillation, or AFib, especially in seniors. AFib creates tiny blood clots inside the heart. If one travels to your brain, it causes a stroke. The American Heart Association confirms AFib increases stroke risk 5-fold. If you feel unusual heart rhythms, don't ignore them. It's your body's way of saying, protect your heart, protect your brain. Sign number 8. High blood pressure. High blood pressure is the silent killer. It damages artery walls, making it easy for plaque to build up. Blocked arteries plus high pressure, a dangerous recipe for heart disease, stroke, even sudden heart attack. Managing your blood pressure isn't just about health. It protects your independence, your happiness, your financial future. The cost of ignoring hypertension: expensive treatments, hospital stays, loss of freedom. Prevention saves lives and protects your wealth. Sign number 9. Swelling in the legs, feet, and skin color changes. Look at your legs, your feet. Notice swelling, skin turning pale, cold to the touch? These visible changes are signs of poor circulation. When your heart weakens from blocked arteries or heart failure, blood pools in your lower body. Gravity takes over. The result? Swelling, discoloration, discomfort. Don't ignore it. It's your body's external warning of an internal heart problem. Early detection helps prevent heart attack, stroke, and long-term disability. I know, after hearing all these warning signs, it can feel overwhelming. You might feel scared. That's normal. But here's what matters. Knowledge is power. And now you have that power. Let's turn that fear into action together. Step 1. The most important conversation. Talk to your doctor. Too many people feel ignored at the clinic. Next time you see your doctor, don't downplay your symptoms. Speak with confidence. You can say, "Doctor, I'm concerned about my risk for a heart attack and stroke. I've been experiencing," mention symptom 1 and mention symptom 2. "I'd like to discuss tests to understand my heart health better." Don't be afraid to ask about specific screenings, an ECG, a stress test, or a coronary calcium scan, a simple CT scan that shows how much plaque is building in your arteries. You have the right to know. You have the right to protect your heart health, your senior health, your independence. Step 2. The life-saving tool you need. Spot a stroke with FAST. When it comes to stroke, every second counts. Every minute lost means brain cells die. Here's what to remember. FAST. F. Face drooping. Try smiling right now. Is one side of your face drooping? A. Arm weakness. Raise both arms. Does one arm drift down? S. Speech difficulty. Say a simple sentence. Are the words slurred or strange? T. Time to call 911. If you see any of these signs, even if they disappear, call 911 immediately. Don't drive yourself. Paramedics have equipment and medication to start life-saving treatment on the way. Recognizing stroke symptoms early can save your life and your future. Step 3. Build a sustainable, strong life. Your daily choices. This isn't about harsh diets or exhausting workouts. It's about small, daily choices to protect the greatest gift you have, your life. Every healthy meal is an investment in your health, your beauty, your energy from within. Every walk is a step toward happiness and wellness for life. Managing stress strengthens your relationships. A strong heart keeps you moving forward toward success, self-development, and financial freedom. It gives you the strength for love, for your family, for your mental clarity, for your spiritual well-being. You've worked hard to build a life, a family, a legacy. You deserve to enjoy that success with vibrant heart health and real happiness. Don't let fear or uncertainty control your future. Walk away from this moment with a new commitment, a commitment to listen to your body, to ask the tough questions, to protect your health, your relationships, your independence, because the next chapter of your life is waiting, and it deserves to be written by a strong, healthy heart. Thank you for your time, for your trust. Be well, and take care of that beautiful heart of yours.